Welcome, everyone. This week, we are going to focus on TCVM, which is Traditional Chinese Veterinary Medicine. There's also the field of TCM, which is Traditional Chinese Medicine. So that's the human counterpart. When we put the V in there, we are talking about Traditional Chinese Veterinary Medicine. So if you are looking for information on these topics throughout the week, we have a lot of information in my books, on our website, in our courses. However, there is also a ton of information available from online and social media sources. But sometimes if you're really trying to dive deep, you might have to put in your search engine TCM instead of TCVM, because there's a lot more that's been written from the human standpoint. And when we get into the food perspective, a lot of the human sites have more in-depth information than some of the veterinary sites do. And that's just because we are finally getting people to get these things onto social media and onto internet sites. So I'm going to do a little bit of reading and take a couple of things. Today, we're going to talk about just TCVM in general, what the branches are. And then during the week, we are going to do a little bit deeper dive into each one of those branches of Chinese medicine. So traditional Chinese veterinary medicine, it's fairly new to us in the Western world. However, it has been used to treat animals in China for thousands and thousands of years. It was developed as prehistoric people tried to understand domestic animal disease, and each generation adds more knowledge onto that. As such, TCVM continues to change and grow as we get new information to incorporate into the system. So even though many of the therapeutic techniques were developed through the trials and observations of ancient Chinese people, TCVM is not immune to the adaptations of other cultures and advances in technology. So we're using information and studies to get a much more in-depth understanding of how the Chinese medicine theories work from an herbal standpoint, an acupuncture standpoint, food therapy standpoint. So while we have tons of information from the past thousands of years of observations, we are now adding some scientific studies to that, which gives it even more credibility. So today, the practice of TCVM in the Western world differs from its Chinese origins. Western practitioners may combine TCVM with other practice modalities, something like homeopathy, Western herbs, chiropractic care, laser therapy, stem cell therapy, prolotherapy. So we are not looking at TCVM from the standpoint of being a standalone as much as we are looking at TCVM as being incorporated into our toolbox that has so many different tools in it. And that's one of the reasons why I love TCVM so much, because it played so well with the other modalities that I used in my practice. Okay. So when we look at TCVM, we have to have a shift in perspective. And when I started learning TCVM, I literally felt like I was studying in a foreign land with a foreign language, because we use totally different terminology and different meanings for different things. For instance, when we talk about spleen in TCVM, we're not talking about that little brown organ that lies next to the stomach. We're talking about the digestive system process of bringing nutrients in and then transforming and absorbing and utilizing those nutrients. So we have to learn a new language and then figure out how to incorporate that into the language that we're already using. The other thing is that Western medicine is really looking at trying to control problems, for instance, get rid of symptoms. And it's also really good in an acute situation. But Chinese medicine looks more at how do we bring things back into balance. And there's a big difference in that. So Western veterinary medicine is more mechanistic, while TCVM is more energetic. Western medical practitioners are very analyzing, doing a lot of analysis of disease process to discover its specific fundamental physical cause, whether it's an infectious agent, an enzymatic defect, or a toxic insult or a trauma. By fully understanding the functions of the physical body all the way down to the cellular or molecular level, one can target the abnormality and better control the disease process. However, when we look at TCVM practitioners, they are looking at imbalances in the body as being the cause of disease. They understand that the body is an integrated energetic structure, and that disturbance of energy flow is what creates disease in the whole organism. When a disease pattern is identified, then we can restore balance and health by bringing the body back into balance and allowing it to heal itself. This is a big difference. So both systems rely on medical history and physical examination to make a diagnosis or identify a pattern. Western medicine aids in diagnostic tests with things like radiographs, blood work, ultrasound, CT scans, MRI. But the diagnostics that we use in TCVM are different. We look at the color and texture of the hair. We look at the texture of the skin. Does it have any kind of discharge or flakiness? We look at the color, size, shape, thickness, wetness of the tongue, the nose, the paw pads. We look at the ears and feel the temperature of the ears. And we also use the sense of smell. So we are looking, we are listening, we are touching, we are smelling, and sometimes we're even tasting. And then we're also palpating and looking at where do we have what we call hot acupuncture points, places where the body reacts when we touch that area. So we may find individual points that we're looking for that tell us, aha, there's an imbalance in that area. And that's where we need to look for, could this be part of the root cause, or is this showing up because something else is underlying it? So a Western veterinarian may recommend surgery or reach for antibiotics, steroids, and other pharmaceuticals, which we know can have so many side effects. But the TCVM practitioner may recommend herbs, acupuncture, environmental or mental enrichment, or tuina, which is a form of massage. They may recommend other forms of energy healing as part of the therapy to try to bring the body back into balance. So generally, both systems, traditional Chinese veterinary medicine and Western veterinary medicine, have the same goal. They want to promote health and prevent disease. They're just two different ways of looking at things. They each have their own strengths and weaknesses. Western medicine, like I said, deals very well with acute diseases and advanced surgical techniques. But TCVM can be sometimes much more beneficial for chronic diseases, especially those that Western medicine cannot control or cure. Due to the more individual nature of TCVM, Western medicine is better for handling herd health problems. And although Western veterinarians promote disease prevention through yearly physical exams and vaccines, TCVM is beneficial for identification of problems and preventing disease through dietary modification or preventative therapies like acupuncture or herbs to bring the body back into balance. So the therapeutics of TCVM can avoid some of those really bad side effects that we get with Western drugs, but the Western drugs do act more quickly. So it's sort of a, where are you in the hierarchy of where's the disease process? How long has it been going on? Is this something that just happened? Is this an acute traumatic incident? Is it an acute allergic reaction to a bee sting or a spider bite? Is this a reaction to a medication? Or is this something that's been more long-standing, going on for a long time, that Western medicine has not been able to solve? So when we integrate the two systems, we can take advantage of the strengths of each system and also minimize the side effects from, well, Western medicine, because I really don't see too many side effects in Chinese medicine. But I will say that I was an integrated practitioner, and bringing the two things together, integrating some Western medicine techniques with some Chinese medicine techniques, gives us, I think, a much more powerful way to help our pets and patients heal, rebalance, and come out on the other side in a much better space. So throughout the week, we're going to talk about 4 branches of traditional Chinese veterinary medicine. We're going to focus on acupuncture, herbal therapy, food therapy, which we all know that's my favorite one, so that'll probably be the longest one of the week. And then also Tui Na, which is a specialized form of sort of a massage and energy healing, but it's a more hands-on. So we're going to go through each of those throughout the week and get you a little more information on those. And I would strongly recommend, if you are interested in TCVM at all, do a little more research, go through some of the resources that we have on our social media and on Dr. Judy and also on naturallyhealthypets.com.